Hi, I'm Dr. Kenneth Thean, and today I'd like to talk to you about melasma. Hyperpigmentation, or brown spots on your face, is a very common problem in sunny Singapore. And of all the many kinds of hyperpigmentation, melasma is probably the most difficult problem to treat. Why? Because melasma is a chronic skin disease that will come back after it's been treated, and deep dermal melasma is difficult to clear. To help you better understand melasma, I'll first go through normal pigmentation, hyperpigmentation, and finally melasma. This is my skin model. The upper layer is the epidermis, and the deeper inner layer is the dermis. At the dermal-epidermal junction are the melanocytes. These are the pigment-producing factories that give you your skin color. These pigment cells are continually producing pigmentation, and the body removes it naturally. Your skin color is determined by a number of factors. Your genes, so Indians have a lot, Caucasians have very little. I'm Chinese, so I'm somewhere in the middle. It's protective. In response to too much sunlight, in order to prevent me from sunburn or cancer of the skin, these melanocytes produce more pigmentation. This gives me the nice tan. Hyperpigmentation occurs when these pigment-producing melanocytes produce too much pigmentation. This hyperpigmentation can be a one-time event like after pimples, or it can be chronic, a constant overproduction of melanin. And it can be superficial or it can be deep. Melasma is a chronic skin disease that nobody quite fully understands. We know there is a genetic predisposition, that's why it tends to run in families. There is a hormonal influence, that's why 90% of melasma sufferers are females, 10% males. There is injury, damage to the skin from too much sun exposure from young. The pigment-producing factories, the melanocytes, produce more pigmentation than the body can remove. Normally, it occurs on the cheeks, but can be anywhere on the face. Besides the overproduction of melanin, we know there is a vascular element and an element of inflammation, which is why treatment of melasma is best done in a multifactorial approach. Now we come to the most important part: how do we treat melasma? Doctors have three ways that we can treat melasma: creams, tablets, and medical lasers. Creams. Two kinds of creams: cosmetic counter creams that you can buy over the counter, and medical grade creams. Over the counter, cosmetic creams are generally too weak to treat melasma. Medical grade creams interfere with the metabolic pathway for the synthesis of new melanin, which is why it takes about 2 months before you start to see effect. Some of these creams, like hydroquinone, are banned in Europe, Japan, and a few other countries because of its side effects, which is why doctors in Singapore try to use the creams for about 6 months, and then we tell the patients you have to stop. And the melasma may come back. Tablets. Tablets also interfere with the metabolic pathway. It takes about 2 months to work, and again, we have to stop the tablets after about 6 months. Medical lasers have come a long way since 50 years ago, and I like to use medical lasers to treat melasma. I use 4 lasers. One laser, which is the same as a tattoo removal laser that goes into the skin, breaks up the melanin, and the body removes it. The second laser I use is a vascular laser that decreases the overactivity of the melanocytes. The third laser is an erbium YAG laser to gently and quickly remove epidermal melasma. And the fourth laser I use is a laser that goes deep into the dermis, stimulates the fibroblasts to grow more collagen and more elastin, generally makes the dermis, the skin, more healthy, and that will suppress the overactivity of the melanocytes. Thank you for watching my video. If you like my video, please press the subscribe button. And for more information, you can visit my website at www.ensoulclinic.com.